Why, thank you. I think the issue that Kim was talking about is partnership, and I think that's the most important thing. And what we have at this meeting is that same notion. And as Ms. Maldonado pointed out, the concept of partnership extends beyond government agencies, leadership in terms of supervisors, owners. It has to percolate into the community. It's bidirectional. We can't deal with substance abuse if we're not dealing with the issue of partnership. We work with research enterprise. We have NIATx represented. We work with the criminal justice system, child welfare. As Melody Heaps is fond of pointing out, we've got to deal with some of these social issues, and our partnership extends beyond the healthcare delivery system, but we're an inextricable part of the healthcare delivery system. So I want to thank SAS and NIATx for having SAMHSA present. We've got a number of staff here. Will the SAMHSA staff raise their hand or stand up so people can see you? All right. The idea is that we can't do business without a partnership. So I'm going to start my slide presentation. We start off with, I always start off with a quote from the chief executive. And as President Obama states, our current economic crisis has only heightened the urgency of our healthcare challenge. And we are inextricably tied to the healthcare delivery system, and we need to see that. We face multiple challenges, and those challenges include reaching those in need of services, providing adequate resources, developing culturally appropriate evidence-based interventions, and building, sustaining a qualified workforce, and integrating substance use disorder services into the public health paradigm. We know that there are problems in the state capitals as well as the federal level because the private sector has withdrawn its investment in substance abuse treatment. 1986, the private sector was responsible for 50% of the tab. By 2003, that had shrunk to 23%. If we don't get health care insurance, we don't get health care reform, that will continue to shrink by our projections to 17% of the tab. And yet we know that substance use disorders continue to plague America and that we need to deal with them. When you look at state and local government funding, it's projected to fund almost most of the substance abuse treatment. As you can see from the yellow, the state share from 1986 would go from 29% to 2003 to 40% by 2014, estimated to be 45%. And if you look in the red, you see the Medicaid share. In other words, states carrying the bulk of the burden, and the states, of course, do have a situation where, given the budget crunch, according to the Center on Budget and Policy Priorities, at least 48 states address or still face shortfalls in their budgets by 2010, with shortfalls totaling $166 billion. And 29 states anticipate further shortfalls. But the other issue is how's that translating? 21 states have implemented cuts that will affect low-income children or families' eligibility for health insurance or reduce their access to health care. 22 states, including the District of Columbia, are cutting medical, rehabilitative, home care, or other services needed by low-income people who are elderly or who have disabilities. And 41 states in the District of Columbia have made cuts, reducing the size of the workforce and the amount of time that a worker can participate, which means that people who are supposed to evaluate applications or evaluate policies, to help draft contracts, they're not there. They're on furlough. So since we're talking about NIATx, instead of reducing the time, that increases the time. The key issue is that we need to keep that in mind. Nevertheless, we still have a large number of people who meet the criteria for needing treatment who don't feel they need treatment are not getting treatment, 19.5 million. And we have almost 1 million people who felt they needed treatment and made no effort to get treatment. And we've got the consequences of substance abuse. We have 58 million people who admit to being binge drinkers. We have 8% of the population, 12 and older, who admit to using illicit drugs. We have 2.3% of the population misusing prescription drugs. We have problems in this country, and it only contributes to those problems if we don't have solutions. When we ask people the reasons that 1 million people, why don't they get treatment, we have two issues, two conundrums. 35.9% say there is no health coverage, we can't afford it. That's 35.9%. But another 26.6% say we are not ready to stop using. When people talk about substance use disorders, they need to keep in mind that we're dealing with powerfully reinforcing psychoactive substances and that it's not an easy thing to get off of. We know that in the issue of costs, we've got the Wellstone-Domenici bill, which which was signed into law in October, goes into effect the beginning of next year. Our hope is that 149 million people will have access to coverage, including 82 million new individuals under ERISA plans. You'll hear more about this, but we also recognize that parity on especially substance abuse treatment will place greater emphasis on cost containment, cost management, cost effectiveness. We don't know how parity will affect therapeutic communities or residential treatments. We think they may have indirect costs. We know that quality become an increasing issue with greater emphasis on accreditation, certification, and licensing of participating specialty programs. We know that healthcare reform is probably going to be influenced by parity, and parity may be a serendipitous precursor to healthcare reform. In healthcare reform, there are a bunch of bills, and we know that there's a House bill now, and the Senate was supposed to have a bill. It doesn't look like that's going to happen until after the recess. All these bills have key themes, however: access, prevention, cost containment, cost management, and electronic health records. When the White House had a conference in December of 2008, this was the community discussion. There are a number of issues. People will talk about quality of care, cost of healthcare service, lack of emphasis on prevention, and difficulty finding health insurance due to pre-existing conditions. These are themes that are recurrent. They're not going away. They're bipartisan. They're the healthcare delivery system. We have to ask, how does this apply to alcohol and drug misuse or mental illness in general? We have to ask, from a recovery-oriented systems of care perspective, how do these services apply to those services not traditionally a part of healthcare delivery systems? We have to ask, what about those providers not traditionally a part of the healthcare reimbursement system? How many of your programs get third-party reimbursement? About 40%, 50%. A lot of you don't. That's an issue in healthcare reform. How do you go about getting third-party reimbursement? With healthcare reform, if it works, then the issue is you've got everybody with a card, or 95% of the population with a card. Where do they present that card? And who are the providers who's going to say, I can do that? We also have to remember the criminal justice and child welfare system. The criminal justice system is responsible, it's the largest single source of referrals to the substance abuse treatment system. What's our partnership with them? What's our partnership with child welfare, which is another major referral for substance abuse treatment? These dialogues have to occur in any kind of discussion about healthcare reform. SAMHSA has gathered input from hundreds of stakeholders and consumer groups, as well as national and international experts, to discuss healthcare reform. The goal is to identify opportunities to ensure that healthcare reform includes mental health and substance abuse prevention and treatment. Based on this input, we've come up with 9 core principles. Articulated national health and wellness plan for all Americans. Legislate universal coverage of health insurance with full parity. Achieve improved health and long-term fiscal sustainability. Eradicate fragmentation by requiring coordination and integration of care for physical, mental, and substance use conditions. Providing a full range of prevention, early intervention, treatment, and recovery services that embodies a whole health concept. Implement national standards for clinical and quality outcomes. Clinical and quality outcomes tied to reimbursement and accountability. Adopting and fully utilizing health information technology. How many of you have electronic health records? That shrinks to about a third, or maybe a fifth.